Hello, today we're going to talk about shoulders. If your shoulder's feeling quite restricted and you're finding it hard to move it around much, and you might have a sort of deep aching pain when you're trying to sleep at night, or a sharp pain when you're trying to reach up for something, it's often classified as a frozen shoulder. But in my experience, it's not always technically a frozen shoulder. Often it's some muscle restrictions, in which case you can certainly do something about that yourself. So first of all, I'm going to show you where one muscle in particular is one that might be the problem. And if we have a look at this skeleton, if you see, here's your shoulder blade sitting on the back of the ribs. Now there's a muscle called the subscapularis, which is one which lines the inside of this shoulder blade and sits between it and the back of the ribs. And it's often one that gets quite restricted, either through some kind of impact or bending over a lot and sort of reaching up for things. So that's the one to look at. It attaches onto the top of the arm here. And I'm just going to show you a picture as well. So you can see it's kind of shape of the shoulder blade and comes out here. Right, so what you need to do is when you're sitting down, just raise the arm as much as you can of the shoulder that's giving you the problem. And with your other hand, if you reach across towards your armpit, and you're going to push with your thumb, keeping it straight, into the back of the armpit, and just imagine you're pushing towards that shoulder blade which lies at the back. And when you've pushed it as far as it will go, you're then just going to very slowly bring your arm forward and across your chest like this. And then if you let go, and you can find another position, again, just pushing in and bringing your arm slowly across your chest. If you find somewhere that's quite sore, then just wait and hold. And normally after about 10 to 12 seconds, it should feel a bit easier. And that's a trigger point in the muscle which will have released. And you can just carry on and bring it back across. If everything's really very sore, then just use less pressure. You'll still get the same results, so that's not a problem. Now, shoulders really like to be moved around a lot. They don't like being kept static. So there's some mobilisations which would really help this sort of situation as well. So if I move the camera slightly, and you can see, so what you need to do is, if you stand in a forward stance and with the sore shoulder, just gently swing your arm back and forth, just as far as it will go without hurting. And if you do this every day, you should find that the amount you can swing will get bigger each day. So you're just loosening up. And then what you can do is also move your arm in little circles like this. And again, each day you should be able to do a bigger and bigger circle. And you do it both ways. You do a clockwise circle and an anti-clockwise circle. And do it several times a day. And you should see an improvement over a few days. It's just really getting that muscle to loosen up. The other thing you can do is against a wall. I'm going to use this arm so you can see. Pretend this is the bad shoulder this time. So what you can do is, if you reach up to the wall as far as you can comfortably go without it hurting, and then just really slowly walk your fingers up the wall like this, and then stop short of it actually hurting. Just, it will feel like it's stretching but not hurting. And again, each day you should feel you can get a little bit further. and you can walk up, and you can walk across to one side and then across to the other side as well. And then to get a bit more of a stretch in it, you can just sort of bend your knees and lean down and into where your arm is, keeping your arm nice and straight at the same time. So that will really help to loosen up the shoulder. There's another couple of stretches which will also help your shoulder. If you take your arm, I'm going to stand up for this. So this will say this is the sore shoulder side. You're going to take your arm and you're going to hold above the elbow and just pull it gently across you like this and hold. And try and hold if you can up for a minute. And then if you turn round and if you take hold of your wrist and again just pull it across your body over the back. And again hold it for up to a minute if you can. Ideally you get more of a stretch if you can hold by the elbow, but if you've got a particularly sore shoulder you might only be able to manage the wrist, and that's fine for starting. The other thing which really helps shoulders is to focus on what your pec muscles are doing. We've talked about this before. So the pec muscle, if it's gone tight, which it often will do if you're leaning forwards a lot, either from working or gardening or something like that, then you just want to stretch it out. Just allow the shoulder to settle back again flat. And there's two ways you can help your pec muscle to relax off. You can actually do some self-massage, finding any trigger points. So you can have a dig around up here and just see if there's any sore bits between your ribs, and if you find one, just wait and hold until it releases. So you'll feel it release because it will just hurt a bit less. And then carry on. You can work your way around there. The other thing you can do is if you just let your arm hang forward slightly, you've got all this area here that you can grab hold of. And it's often quite sore, particularly on the edge. But if you just give it a squeeze, you might want to rest this other arm on a desk or something. But give it a squeeze all along. Anywhere that's sore, just hold and wait. And that's treating the trigger points in your pec muscle. And when you've done that, you want to do the good old doorway stretch. So for those of you who are not familiar, I will just quickly go through that with you now. Okay, so the doorway stretch for these pec muscles is you find yourself a nice door frame and you stand right up inside it, so your feet are on the threshold, and you need to put your hands on the door frame. It doesn't matter too much which part, because different heights will stretch different parts of your pec muscle. It's quite a big old muscle, so you can play around. If your shoulder's particularly sore, you might feel it's more comfortable further down. If it's not too bad, you might want to go further up. But good idea to vary it anyway if you can, just to try and cover the whole muscle with a good old stretch. So all you do is lean through the door frame, keeping your body nice and straight. Keep your chin tucked in and the back of your neck long, so that you're not creating any neck pain when you do it, and try and hold it for a good minute. And if you did this a few times every day, you'd really notice quite a big difference. Your shoulders would feel a lot more comfortable as a result. And that is the doorway stretch.